First up tonight, we have a warning from officials as that Omicron COVID subvariant drives up infections and hospitalizations. We're certainly seeing those trends in new numbers released in North Carolina today and nationwide. CDC saying 75% of counties are in the medium or high COVID community level.
For the first time in months, Mecklenburg County health leaders held a media briefing this afternoon. WCNC Charlotte's Chloe Leshner joins us live from the health department to tell us the big takeaways. Chloe.
Mecklenburg County health officials were hoping we'd have a quiet summer on the COVID front, but the BA.5 subvariant is disrupting that. We're seeing an increase in some key metrics, and officials say with so many people testing at home, they know it's actually an undercount.
COVID and all of its mutations making moving forward challenging. Mecklenburg County is in the CDC's medium COVID community level, but the BA.5 subvariant of Omicron could change that.
I do anticipate at some point we may transition to the high level if the current trajectories continue.
BA.5 now makes up about half of the COVID cases in the state and county, and it's driving an increase in case counts and hospitalizations. The latest data in Mecklenburg County shows that in the first 2 weeks of July, case counts increased 10% from the previous 2-week period. Statewide, more than 1,000 people were admitted to the hospital last week for the first time since February.
The goal now and has been preventing people from getting severely ill, dying from COVID. So the best way, again, to do that is staying up to date with vaccines and, taking the protective measures to protect the highest risk individuals.
BA.5 is the most contagious strain yet. It's forcing once familiar concepts like herd immunity out of reach.
So if people are not protected because they're vulnerable to infection because the virus is now able to evade their immunity, then you seeking or trying to achieve herd immunity is not really feasible.
Doctors are encouraging people to stay up to date on their vaccinations and boosters to try and prevent us from moving up into that high level. They say at this point, the majority of shots that they're giving are those booster shots. In Charlotte, Chloe Leshner, WCNC Charlotte.